executive session.
We have a motion. All in favor, say aye.
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 Mr. Chair, I would move that we approve the exceptional placement as discussed.
A motion. All in favor, say aye.
Aye.
Aye. Look how easy we are today.
Thank you.
Thank
Caught
you,
us on a
guys.
good day, huh, Dave?
Have a good day.
Have a great day. You too, bud.
All right, Todd.
So good morning, I'm Todd Mauger with Bannock County Juvenile Justice in the Village. I have a couple things, three things to discuss today, and well, maybe four things. And three of them are related to funding for the Village and the Assessment Center. The first is just to kind of give you an overview. The state isn't providing additional funds for assessment centers starting this year. However, the Department of Juvenile Corrections has put out a mini grant for screening assessments, enhancing those, and data that will allow us to purchase our data system, our screening tools and assessments, and possibly add some more computers is what I'm looking at, and possibly some training. They've put forth $350,000. I did attach the grant application guide and then a blank grant because I haven't started writing it yet. I'm going to ask approval for that. But before I do, I think it's important to talk about the other issue. Earlier in the year, the Department of Juvenile Corrections sent out a memo adding $48,468 to our original grant award for state fiscal year 23. With that, they're allowing us the ability to carry it over to state fiscal year 24. So when you look at that, what they're recommending is that we apply for a grant for state fiscal year 25. I've got my years messed up on this, I believe. What we would do is use the grant funding if we're able to apply and receive it to purchase those screening and assessment tools for the next state fiscal year, and then we'd be able to carry over the $48,468 and use that for utilities and other expenses that are approved by the grant, and it can be carried over into additional years. So today I'd like first off to request approval to apply for the grant application for the Assessment Center fiscal year 2025. And then request a signature on the limited longevity support year 2 addendum, and that's acceptance of the $48,468 that they added to our grant award. And then after that, if that's approved, I'd like to request that those funds be carried over into state fiscal year 25, and it looks like we need to change the 24 on that form to 24 and 25, if that makes sense, to project year 25, right? Because state fiscal year 20.
Yeah, because that ends June 30.
Yeah.
FY 24
Yeah.
is ending then.
Yeah. If that makes sense, state fiscal calendar, and I'm pretty sure though.
Unless they're letting me use money in arrears. Some grants do that. But we
Yeah.
can work the dates out. How's that? If approved.
No problem.
I hope it made sense. So we have an extra $48,468 that they've given us if we accept it. I'm asking for that, and then with that, I would submit the carryover request that would allow us to carry that money over in July. And what they do is they forward the money, and we put it in our account. I just have to report on the spending and then report our data outcomes at the village to them.
And I'm looking through the grant thing, I don't see where there's a match for the grant. It doesn't look
No,
like.
there's no match.
Okay.
High scores, that's all I can see.
Yeah. What's going on? Nancy, were you feeling really good when you scored this one? Ooh, very nice.
No, I have no problem.
Yeah, I have no issues with this. No. All right, Mr. Chair, I would move that we approve application for the grant as requested. I also move that we accept the addendum for the longevity support and approve carrying the funds over to state FY '25. That was it, right? Okay.
The grant, accepting the funds, carrying over.
1, 2, 3,
That's it for now. And
three
then,
signatures.
Trifecta.
I appreciate that. And then, as you're aware, when we,
Vote on all this?
Yeah.
oh, sorry.
We have a motion, all in favor, say aye.
Aye. You're so excited.
Well, I got stuff to do. No, sorry. Probably my ADHD, but, so, as you're aware, when we moved over from the intake and diversion unit at juvenile justice to the village, a lot of our job descriptions changed, our policy and procedures changed. We're now, have pathways that allow, we're screening citations from law enforcement prior to kids going to court in hopes that we're able to keep them from going to court. We have a pathway for self-referrals, so we've got families coming in the front door looking for help for early intervention and prevention services. We also have, the school is referring kids and families, and then we do have medical providers now that are referring kids and families for services. And so now we're doing a lot more screenings, assessments, and setting up services and case management. So the employees that we brought over, their job descriptions don't necessarily match what they're doing. And so I brought 3 job descriptions that have been adjusted. And I'll start with the restorative conference and family group decision-making position. That was the position at juvenile justice. As we're at the village, we've adjusted, or we're requesting to adjust that position to be restorative conference coordinator and prevention specialist. And what the major changes in this job description are really the assistance to completing screening and assessments for families, as well as some case management for some of those property issues, property crimes that they will be dealing with, doing the restorative conferencing. There's some additions into assisting with training of AmeriCorps workers and interns. As you're aware, we created that memorandum of understanding with Idaho State GEM AmeriCorps program. And in looking at our data, those individuals are providing about 1,500 hours of service to the village each quarter. And so training them is key, and providing support to them. And so that's been added in each of the job descriptions as well. So that's been added to the restorative conference and prevention specialist position. And so I'd like to review that one. The grade stays at a grade 8. There's no change. The second position is the prevention coordinator position that will change to person property prevention program coordinator. And some of the major changes with this one would be the same. They're performing screening and assessments. They're still doing case management, but the case management's going to be stepped up quite a bit because we are reaching out and getting services in place for these families. In the past, they were just looking at a court order and saying, did you stay out of trouble? Did you pay your fee? Did you do your community service? And so, and then in addition, because we have the restorative conference coordinator, that individual never had the support of another employee, and so we've added that they were going to assist with the restorative conference coordinating stuff because they're actually supervising some of those property crimes as well. So we would have 2 people that are involved in the restorative conference process, which I think would provide support. And then the third one,
And that one's
Oh,
staying at a grade 8?
yeah, it was a grade 8 to start with, and it'll still be a grade 8. They're all 19 hours a week positions. And then the third one, and this is the one that had the most change, and basically it was a multidisciplinary team facilitator and program coordinator. And they were facilitating MDT meetings, our Rule 19s, our Rule 16s, and then they were running some groups, the Get a Grip group, which was a community group, but they were helping run that. We no longer do the Get a Grip group, and POs, probation officers, and our prevention officers are actually the ones that are doing the MDT facilitating, and they actually kind of prefer that because they know the case, they know the family. So we would like to adjust that. It's a grade 8, 19 hours a week, to be a family engagement, self and community referral program coordinator. And really the job duties on that will be to provide support to the intake and diversion unit of the village, and then they're going to be kind of that front door person overseeing the engagement, screening, and assessment process of youth and families that are referred through self-referrals, community resource workers, which would be the school, the community, and those medical providers. And then they would also follow up and do case management. And in this as well, they will help provide cross-training direction and assistance to the AmeriCorps service members, interns, and other volunteers.
So we're not hiring any new people. These are all positions that were already there.
There are positions that are already there.
Changing the names
Yep.
on them.
Yep.
And all the pay, the grades are all,
They're all the same. We just recently hired for the first 2 positions because they were still pretty similar. And so those individuals will be starting the end of, or in May sometime. And then this MDFT position that's going to change to the family engagement coordinator is open. And so if it was so much different, I felt like we needed to get it approved.
I'll tell you, I appreciate the new descriptions, job descriptions. I thank you very much.
Well, and then we do have a few more in the works. Our youth court coordinator, she's now over the citation process, and then alcohol, tobacco, and other substance like case management. So those kids that are being referred to us for alcohol and tobacco use. But there was some discussions this week kind of regarding how we were wanting to handle those through the court system, and so I wasn't 100% sure. I wanted to be 100% sure before I presented it, so I will be probably coming back in the next couple weeks to review that job position with you and job description.
No, it's great to have updated jobs description.
Agreed. I'm good.
Thank.
I'm good.
Good. Motion on those.
Mr. Chair, I'd move that we approve the revisions to the job descriptions as presented.
Have a motion, all in favor, say aye.
Aye.
Thank you very much.
Would you maybe send those to the HR email? And then just note that they've been approved today.
Yes, I did submit them to Josh
Okay.
a week or so ago.
Okay, perfect. I'm just trying to think of how with the transition, those can be included as final approved job
Yeah,
descriptions.
yeah.
And then maybe mention which ones they replace.
Okay.
And then that way we can just facilitate
Okay.
change.
The update.
Yeah, I'll do that.
Thank you.
Do you know why do you want me to change those dates on this and then get, okay,
They signed those.
Okay.
Christie will take the originals to Mandy,
okay,
and we'll just see if any of them need changed before
okay,
they're submitted.
okay.
So Mandy will get with you.
All right. I appreciate all the support. Mandy's been awesome.
So, while we have you in the hot seat, give us a brief update. How's the village going?
So I think we're making a huge difference in a lot of kids' lives and families' lives. When we, and I've got a little bit of data, but I could pop it open and share it with you. But I think the main thing, and I always try to kind of put things in perspective. We've been open 7 months, right? We've made that transition. I think a lot of times I want change to happen now. And so I'm not saying we're where we want to be, but we've made significant improvements. Some of the things that I could highlight, I think we're doing a really good job of connecting families with the YES program, so those families that come in and don't have Medicaid and they don't have the ability through their insurance to afford counseling, medications, therapy for their sons and daughters. We're able to navigate the youth empowerment systems of Idaho. There's a 1-800 number we can call, and Liberty Healthcare is contracted through the state to do that. And so in the past, it would take maybe 2-3 months to get a family covered under that program. I can tell you that we've created some relations with Boise and Liberty Healthcare, and we're getting those assessments done. We had one individual youth that was admitted to the emergency room for suicidal ideations. He was under the age of 13, so we couldn't do our direct admit process to the Behavioral Health Center in Idaho Falls. Those kids that are younger have to go to Utah or Boise. The family didn't have insurance that would cover that, and we were able to navigate that in a manner in which it was taken care of in a week, where they were doing the assessment while they were watching him up at the emergency room. So we've also worked out a direct admit process with the Behavioral Health Center. So when these youth and families come in, one of the things I'm seeing on the screening tool, one of the areas it gives us is a self-harm risk score. And a lot of these kids are scoring very high in that area, and we didn't have any resources. So we've worked out with the Behavioral Health Center in Idaho Falls, we can do direct admits. And so I'll give you an example. I had an individual that came in last week, or it was actually this week, it was on Monday. We'd come from a school hearing, and during that hearing I could see that the kid was a little upset, like there's something not right, and I asked her to come in. We got her in to see our psychiatrist at the University of Utah. He let me know that she was in a situation where she needed to be admitted. We made the phone call, and she was admitted and is receiving, hospitalization care right now in Idaho Falls. And so when you look at that, we've probably done 8 or 9 direct admits since July. Those are kids that are on the brink of suicide, right? Without intervention, there's a good possibility they wouldn't be with us. And so I feel strongly that we're moving in the right direction that way. We've seen about, our stats we did 96 screenings during January to March 31st. We have those intern counselors from ISU that are actually providing crisis and triage counseling for the youth and families. My computer's not turning on, and I've got it here, but they served 27 families during that quarter. And off the top of my head, I want to say they did 67 hours of sessions with the families and youth. The goal is to get them into, like when we get kids and families signed up for counseling and therapy with local providers, sometimes there's a 4 to 12 week waiting period, and so they're filling that gap during that time with crisis and triage counseling. So yeah, I think things are good. I think we've got a ways to go as far as getting policy and procedures together that fit what we're doing. And I can kind of give you some. I can give you a rundown of our stats real quick if you'd like, just so you have an idea of where we're at. I'm working on our. So we had 135. We'll just go quarter by quarter. The first quarter we had 126 referrals. We provided 89 screenings to those 126. Sometimes the kids and families aren't appropriate because they're on probation already and they're receiving services. But we did 89 screenings. We identified 43 youth and referred them to internal or external clinical assessments. We had 89 of those youth that were connected to services and support through case management, and all 89 of those were participating in services. During the second quarter, and this is state fiscal year, we had 256 referrals. We completed 121 screenings. We connected them with, of those 121, we connected them with 38 clinical assessments, either external or internally. So it could have been our psychiatrist we have from the University of Utah, or another agency to do comprehensive assessment, and 121 participated in case management. This quarter we had 135 referrals, and we had 96 screenings completed. I have not ran the data yet. I'm working on it, on how many we've connected with services. Our data system, we're still getting it put together. I have a meeting Monday to where hopefully we can start pulling some more data out so we can discuss, see our program evaluations, how many we've committed, how many are receiving counseling, that type of stuff. But I would say overall, I'm sorry. I don't know why that did that. I don't even know how it did that. I don't even think I'm connected to the internet. Anyway, so I think we are moving in the right direction. So, any questions? I do have probably information if you.
No, I just, like I said, we've been 7 months. We're headed in a very positive direction from all I see. Everything that I've heard has been positive.
Yeah.
And all you have to do is say, if you had 8 individuals that you've helped not commit suicide, that's, in 7 months, that's pretty impressive.
Yeah. Yeah. It'll be interesting to look at the suicides youth suicides in Bannock County from year to year to year to the year we started. I think you'll see a significant decrease in that. Our counseling data, they actually served 27 youth last quarter. They did 63 sessions and 95 hours worth. So, I mean, that's also free mental health services that are being done as well.
Well, just, you offer hope to a family that sometimes I don't think they knew that there was a resource there.
Yeah.
And I think it's out there now that.
Well, the system is hard to navigate, right? If you don't know who to call, when to call, what to say, it's really hard to get started in services. And so, our staff, we understand this is the number you call for this reason, and this is what we do. And so, yeah, it's been good. I do feel like we're making a difference. I think there's, absolutely room for improvement, but after 8 months, there should be, right?
But we changed the philosophy that it was in the jail, and now it's a resource.
Yeah.
I mean, that is huge.
Yeah, and I think there's still a long ways to go as far as changing that idea of citing kids to get them help. I think that was one of the big that's one of the big reasons we have so many kids in juvenile court, is they know it's a resource and a support. And if we can show that there's an easier, faster, quicker way, and we can get to them 2 or 3 years earlier before the problem is worse, it'll be good. But yeah.
I have a question for you.
Yeah.
So you had quarter 1, 126 referrals, quarter 2, 256, quarter 3, I think 135.
Mm-hmm.
Are those unique individuals each time?
Yes. Yes.
So every one of those is a different person?
Yes.
And the same would be true then for the screenings?
Yes.
Everyone's a different person?
Yep.
Okay.
Yeah.
So that's like over 500 people so
Yeah.
far.
Yeah. Yeah, and if you look at the amount of staff we're trying to do that with, Davey, our staff offender coordinator, got a new job. We're hiring that. So right now, really we're operating, and then we're bringing on the 3 other positions because they've moved on. So we're doing it right now with one full-time employee, myself, and 2 part-time, and then AmeriCorps workers and the interns.
Wow. What's the breakdown, do you know about percentages? What's the breakdown of where the referrals are coming from?
Yeah, I can tell you that, actually. So, in the first quarter, we had 14 self-referrals, 3 school referrals, and 72 law enforcement referrals.
14 self, and what was the second one?
School, 3 school,
3 school, and what was the last one?
72 law enforcement. So those are kids that are cited, or most of those were kids that were cited. As we've gone on, the law enforcement, the school resource officer are realizing that they can just refer kids without a ticket, and we've had success doing that. So the second quarter, we had 26 self-referrals, 16 school referrals, 1 child protection referral. So we had a kid that was in foster care or that health and welfare didn't know what to do with and brought them our way. And then we had 213 law enforcement referrals. And then I didn't put the third quarter down, but I've got it on a spreadsheet right here that I was just... So in the third quarter, I'll have to do a little math, but we had 18 self-referrals and 9 school referrals. And then the rest were law enforcement. So what does that make it? I was working on that
So
before.
a little over 100 law enforcement.
Yeah, yeah.
Pretty impressive, especially with your staff.
Yeah, I'm looking forward, so the AmeriCorps programs provide us an awesome opportunity to bring students in, and they work, they serve, and then they're learning the system, what to do, and they're gaining knowledge, right, in what we're doing, and then they're a great pool to hire from, right? Because you know their work ethic, you know what they're about, you know who they are, you know what they can bring to the team. So the 2 we recently hired were both AmeriCorps interns in our building, and the other position has got, we got a few interns and AmeriCorps members that are interested in that too. So it's a great opportunity to.
Well, thank you.
You're welcome. Feel free to come by anytime and check it out. So.
Yeah, it's been about 7 months since I was over there.
Yeah, I think you were over there for the blood drive not too long ago.
No, I wasn't there for a blood drive, I guarantee you that. I was there for a Percy deal.
Okay, Percy, that's
Percy
it.
deal.
Okay. All right. Well, thank you.
Thank you, Todd.
All right, Anita?
Anita Hymas, Bannock County Assessor.
Randy Hobson, Chief Deputy Assessor.
So we're coming before you today on the exemptions that require your approval on them. I am going to brag a little bit. We sent out at the beginning, in January, we sent out a little 5x7 card, just a little reminder, gave them our county website so they could still utilize the county website that was set up. And we've got them all back. So
We're not going to have the 30 that missed it
No, I'm going
last
to pat
year.
myself on the back on this one, and pat Randy on the back too, because he's been kind of the main person in this. So we'd sent you 2 spreadsheets. One was one that, most of those were ones that, well, all of those were ones that you approved last year, and that are just the standard annual ones that have to be provided. We did have some questions on the other spreadsheet that we sent you, and those are the ones we're going to come before you today for, and I'm going to let Randy have the reins.
So to start with, let's go through the ones that you approved,
Okay.
okay? And did you guys have a chance to look them over? Do you have any questions?
No.
I didn't have any questions about
Right.
them, so we could just make a motion and approve them
Right.
to start with, and then we can start into the others if you have questions about it. Just get that out of the way.
So, Mr. Chair, I move that we approve the approvals that the assessor did as requested.
We have a motion, all in favor, say aye.
Aye.
Aye. Christie, you can come up too if you want.
All right, so the other spreadsheet that we sent is the ones that we figured you guys would want to look at a little closer. Most of these have applied in the past. Some you've denied in the past, so there's just question and we need your approval, I guess, so.
What direction to go, huh?
Yeah, exactly. So the first grouping here is BMH, Bingham Memorial Hospital. Do you want us to go through these one at a time, or? I guess most of them are just one parcel until we get down later into the Portland Health Trust stuff, but, well, I guess it varies, but, like this first one, do you want me to read the parcel number?
Parcel
or-
ending in 100?
No, it ends in 207.
207.
86207. So it's RPRP CPP 086207. Bingham Memorial Hospital is the organization applying, but the legal property owner is Pocatello Hospital LLC.
Okay.
I printed them in order that they're in the drive, so I don't know if they're in
Well,
the same order.
they are, but I didn't put them in parcel number order, sorry.
Yeah, we put them in.
We put them alpha.
Well, they're in,
So we can-
they should be alpha.
Yeah. Oh, they are alpha, I just didn't put them in,
Okay.
if they have more than one, I didn't put them in parcel number order. Sorry.
All right, so
Okay, so the one ending in 100, we'll do that.
working off the spreadsheet.
Okay.
Okay.
Is this the Crestwood Enterprises?
Yeah, should be.
Yes.
Okay, so the organization applying is Crestwood Enterprises LLC, legal owner of the property. Bingham Memorial Hospital is 37.5%, Pilster is 37.5%, and Fulmer is 25%. Last year it was denied.
They're reapplying.
They're
again.
reapplying this year.
So last year it was denied. Was that appealed?
I don't believe they
believe
appealed
so.
last year.
But the reason, I mean, if you go down there to Please Tell Us in 10, Bingham Memorial Hospital owns 37.5% of the property and leases the remaining to a non-owned proportion. So that's why it was denied,
Right.
is that
We're leasing it out.
they're leasing it and they only own 37.5% of it. So,
You should have them in your email.
I'm looking at,
Okay, perfect, sorry.
so for the same reason that we denied it last year, I deny it this year.
We just wanted to verify that.
I mean, and that's where a lot of these are gonna be.
Yeah.
Right.
And then
we realize
number
that.
11, it says the clinic is fully occupied by physicians and advanced practice providers employed by Bingham Memorial Hospital.
How many of these are, or do you think are going to be different from what they were last year?
As in the decision you made?
Yeah.
Um,
Do you have any hot spots?
we do have a couple hot spots.
I would say, let's just talk about that, because if most of them are going to be like this one,
It's just
I would
that-
rather
yeah.
focus on the
It's
hot
just
spots.
We don't have the authority, of course, to deny it, so that's why we brought them over. But I'm good with that. Okay, go to the, and so all three of these BMHs, there's the three of them.
Yeah.
Okay? And they're all the same type of thing.
And that's any property that is owned by the nonprofit, but leased or rented out, they're not tax exempt.
Okay,
I mean, that's what we've been told by legal counsel.
okay. And that
And
one's
I
the
actually
same
had
thing.
4 attorneys agree with that, and that
Okay.
is unusual.
All right. And that's the same thing.
Well, this one was approved last year.
Right,
So
we're-
we kind of lumped all the Bingham Memorial Hospital in together. And so there is 1, 2 in here that were approved last year. It's basically the property on Yellowstone in front of Fred Meyer, that clinic that they own and
They're
operate.
the urgent care ones.
As a, Yeah.
And that is
so-
owned and operated by Bingham Memorial.
Correct. And then they operate at 1595 Bannock Highway, owned and operated by them as well. So those two would be approved, which should be on that approval list.
Okay, and we'll make up a new list and you can submit
Okay.
that to us.
So the next group is Central Christian. They have a number of different parcels.
And they're the ones that didn't submit on time last year.
Exactly.
And when the lady come in, she says that they charge her and the maintenance guy rent
On those houses?
on those houses.
Okay.
And as long as that, they're charging rent,
We're gonna deny it.
we denied them.
Okay. And that
Yeah,
that was our
the letter that they provided us this year, it does say that
Reduced rent.
it's exclusively used by the church as employee housing as a function of their duties. On-site custodian repairman, reduced rent fee is part of the employment agreement.
But when she told us what the fees were on that rent, it wasn't really reduced rate.
Okay.
And so that's why we decided, no, we're not gonna,
Perfect.
Okay.
Go ahead.
So the next one is the Church of Jesus Christ of Latter-day Saints. It's the property up on Princeton. That is currently not being used as a religious facility. They are leasing it to the school district for their costs, according to them.
You leasing it for what?
For the school district.
District
Highland
20
High School is using it.
District 25, Highland High School's using it as a classrooms since the school burnt down. This one I have, because they're both nonprofits.
Right.
Neither one would pay taxes.
Right.
So I
don't see him changing the use of that anytime soon. Highland's not in any
No.
rush to be rebuilt.
And that's kind of where we were on this, but we.
I think they have a 3-year lease on it.
Christie, do you have a
I
question?
did talk to Alan about a similar situation with Calvary Chapel, also with leasing. And this was last fall, because Calvary's pastor called concerned about the situation. And Alan said it is completely fine because of the way that it's worded in the statute. And I can't remember exactly without looking at it, but the way it's worded covers both, and it covers the school under, the church's building, so.
And that's why I understood it too. So
Okay,
I would say that that one would be non-exempt, or exempt.
Concur.
John? Okay.
Okay, Eastern Idaho Electrical Joint Apprenticeship did not apply last year. So we thought we'd bring that before you to get, it's,
And this is a union,
yeah,
and then they just,
Apprenticeship Training Trust Union. They are applying, they marked for school and educational purposes, so they do hold journeyman classes there and such.
and all unions we've exempted before. So I would treat them the same way that we've treated the others.
Agreed. Goodwill is leasing a building from it's an individual now.
If it's an individual, it's taxed.
Yeah. Okay. There's a number of applications from ISU, and these applications are coming from the state of Idaho, up in Boise, because Idaho State University is leasing property for different things. So, this first one
Who owns
is-
the property?
This first one's owned 4914 Yellowstone LLC. So it's that, it used to be a credit union across the street from Smith's. It is owned by an LLC, it's not a nonprofit.
Then it's taxed.
And I think all these,
I mean, if it's the owner
Right.
is not the nonprofit,
right,
Okay,
then it's taxed.
because one of these is even in McCammon and is based in a private
Yeah,
place.
yeah, I read that one. It's a
It's a
hotel.
pharmacy.
All right.
Yeah, no, can't.
If it's owned by a private individual, it's taxed. I mean, that's what them attorneys told me.
Okay. That one we're okay. Well, that one, we probably need to have Nancy read that one in. We
This?
missed it. Because we have one that is youth ranch, but it's just their personal property, so they would be eligible for it, but we didn't get it on our approved list. So do you want us to read that number to you? I don't know how you want to do
Just,
that.
you'll send us another approved
Okay.
list. We'll add to that.
Okay,
Another union-type situation that didn't apply last year, Pacific Northwest Iron Workers. Approve. So this next group is Pocatello Hospital LLC.
but that's just one, right?
And it's just like Bingham, even if the hospital, if LLC, if Portland Trust owns it,
So this
but
one
they're
here
leasing them
actually,
out to somebody else, they're taxed.
this is actually the, what is it?
This is the sports medicine building on campus, is what this is.
Is what?
The sports medicine building
Oh,
up on campus.
up on campus.
By the mini dome, or,
Attached to the mini dome.
But those are doctors that are making profit off of that business.
yeah.
And so Portland Health Trust picks and chooses which one they charge full rent and partial rent to. And we said that that's not right.
I don't believe this has anything to do with the health trust.
No, this is Pocatello Hospital LLC.
Okay.
And Pocatello Hospital LLC.
Well, then it's,
So I think they're applying as education because it's used through ISU and some of their
no.
programs.
And this particular building, we missed, it was exempt for a long time, and we missed it. And so we put it back on the rolls, and so this year they're reapplying.
But they still have the orthopedics and everything else in that, and that those doctors are making great profit off of what they're doing.
Okay,
So it's a business, not a nonprofit,
okay.
in my opinion.
Correct.
This next one is between Grace Lutheran and also Pocatello Chubbuck Auditorium District. And I'm gonna be honest, I'm not real versed on auditorium districts where we need to go with this, but they are actually applying on, some of their parcel numbers are on the same application. Grace Lutheran has applied, and it's mostly for the right-of-way up there, of Way to Grace right-of-way up there.
Yeah.
It's mostly on that, so I'm not sure why if it's a right-of-way, we don't always put a value on it anyway.
And that's where I think that because it's an auditorium district, they're special taxing district and stuff, we're not gonna tax taxpayers on Bannock County twice
Okay.
on the same properties,
Okay.
in my opinion.
No, I think
Just
you're correct
never,
on that
yeah,
one.
okay, sounds good.
Especially where it's just a right of way, that's kind of weird.
The next one was applied, it says organization name, Portland Greenway Foundation. It's owned by Go LLC.
That's privately owned ground that they use and it's taxed.
Okay. Okay. And then, is this all? No.
There's 3 or 4 of them.
So the next group is Portland Health Trust, and we don't have any idea where we're at with that.
Have they submitted all their forms?
They did.
I would like you to send them to us individually,
Yeah,
so
I can do that.
that,
Should have it.
because this is an interesting deal, and we've had some conversations. I'd like to look at them.
Can we go back to the previous one for a second?
The Go LLC,
Yeah,
Portland Health.
because that is property that the Greenway is on,
Right.
so there's no money generated by it. They're essentially donating the land for the Greenway to exist on it. Am I reading that correct?
The Greenway does go through the land, part of it, the trail system.
The
It is a-
land is owned by Dell's Incorporated,
It is a
right?
28-acre parcel.
Okay.
The trail isn't.
Is there anything else on there other than the trail?
I believe so.
It-
The
They've
trailhead.
taken some rocks and stuff out of it, like, it almost looks like kind of a quarry pit on one spot of it, but other than that, no.
Okay, I was misreading that. I thought it was all the trail. So if it's not all the trail, then I'm okay with where we're at.
Yeah, Dale's have come into us before.
Yeah, I just couldn't remember that.
So we'll send you the Department of Health Trust information.
I can do that.
Yeah, I'd just like to look.
One question we do have on that, so Department of Health Trust, all the applications we received are for real property, so there's no application on personal property. However, we have gone through and, well, I don't even know what to say with regards to this. Probably.
Yeah, because it's kind of like Commissioner Moser said, it's a different situation, so we're just gonna,
We're not sure how to treat their personal property either, so
Okay,
it's not an application.
oh, okay, I know what you're talking about. So he's talking about the 23%,
Yeah.
and I think we've discussed that before, and the 20% is just kind of a given.
we've allowed them to have the 23%.
We have allowed it for this year, we just didn't know, because we would take it off if we had to, but we'll leave
No,
it.
I think we still allow the 23%
On the personal property.
from our discussions.
Okay. This one here, this is Praise Temple of God, the property over on 11th. As of the lien date, January 1, it was owned by Praise Temple of God. We were informed that it was not being used as they were trying to sell it. It did sell in March, I believe. It is now owned by Iron Hall LLC, and this application is actually Praise Temple of God, not Iron Hall LLC, so.
So they're not the owner, they don't have the right.
And then finally, the last one here is Wesley Foundation. Last year, we had them on at 50%. He gave them a 50% exemption. This year, they're applying, they are stating that the basement is no longer being rented out. So they are applying for 100%.
Okay, Christie.
So the person who runs the foundation or works for the foundation is living in the basement now. So they are not collecting, from what I understand, that's part of his pay.
So we'll give them the full exemption on that one?
Yeah.
Okay. All right.
All right.
I thought you.
Okay?
Okay,
all of
we're
them.
good, thank you.
Hey, thank you. Appreciate all your work there, and then we'll look at the Health Trust. They'll send us that paper.
Have a direction. Works for me.
Well, Maggie and team.
Good morning. Do you need handouts? I know we emailed what we have, but if you'd like a hard copy, I can
I've
get
got
that
the
to
hard,
you.
I've got the handout.
Christie's on top of it.
Yes, she always is. So you all
Yeah, do you want me to email it to you? Okay.
You all know Ken Keller, our environmental health director, and this is Matt Merrill. He's our IT services director. I sometimes bring members of our management team along to these meetings because they're interested in the process as well. So, and this one is easy for them to get to without a lot of travel time. So we'll just go ahead and jump into our proposal for our fiscal year 2025 budget, which again runs from July 1 to June 30. This is the budget proposal that our Board of Health at their April 11th meeting voted for us to move forward with presenting to the counties as our proposed budget. Our budget hearing will be on Thursday, May 23rd at 9:30 in the morning at our Pocatello office here. That information is all on the cover sheet of the handout that Christy forwarded to you. And you may also attend virtually if you'd like to, and that information is on the cover sheet as well. Any questions about that? Okay, so we'll go ahead and get started. So on page 1, this is just some language from House Bill 316. That was the bill that passed several years ago that did a number of things. It eliminated county medical indigency and the state cap fund. It also eliminated the state general fund appropriation to the public health districts and placed the responsibility for the dollar amount of the 2021 fiscal year state appropriation to the public health districts on the counties, with the idea that by eliminating the medical indigency fund, that would be sort of an even swap, or some counties would come out ahead, some counties a little bit behind on
About
that.
$1 million behind for Bannock County now.
Really? Because that's not what IAC has said.
Because now that public defense is gonna go that way, we still have obligations for all their back pay, all their vacation pay, and their rent until 2029. We just learned that about 2 months ago.
So that's separate though, right? From
Well, that's the obligation that
316.
Bannock County will have because we moved the indigent monies towards,
The medical indigency fund.
but Bannock County's still gonna end up about $1 million in the hole.
Okay.
So it wasn't a pleasant thing for us.
No, no. So on page 2 is just a summary of our revenue sources. Our largest revenue source is our subgrants and contracts. Those are typically federal dollars that come to state level organizations that then subgrant with us to provide services at a local level. That's just under 50% of our revenue. 25.2% of our revenue in the gray comes from fees for services. 24.8% from our counties, and this year we did include funds from the opioid settlement. We are receiving funds directly from those settlements. Some of the companies have chosen to sort of front load the dollars, and so we've placed those in a restricted fund, and we are only drawing down the dollar amount per year that we need to provide services, or that we project that we'll need to provide services. So that's about 1.5% of our revenue. On page 3, this shows a 10-year history of contributions to the state, to the counties, and the counties to our public health district. So the original county aid that the counties have provided since our creation in 1971 is the blue bars. The additional county aid or former state aid is the orange bars that began partially in fiscal year 22 and then was fully implemented in 2023. The gray bars are the state general fund contribution, and then the line over the top is the total. So as you can see, since about fiscal year 2021, we've pretty much had level funding from our counties. So moving on to our request for this next year on page 4, we'll start at the top and work our way down. So for our current fiscal year, the total counties pledged from all 8 of our counties is the dollar amount of $1,227,796. There was no adjustment in 2024 for the fiscal year timing difference because we asked for level funding last year as well. The dollar amount of the additional county aid that was shifted from the state is $1,142,300. So the total 8 county contribution is $2,370,096. There are no changes to any of that aid for our proposed 2025 budget because we are asking for level funding. So the total budget request for our counties remains the same. And we'll dive into that on the next page, page 5, and we'll start at the table at the top. So as you may recall, the county aid is distributed based on a funding formula that is set in Idaho code, and the code reference is at the top of the page there. It's chapter 39-424. It has 2 components. 70% is based on population and 30% is based on assessed market value in a county. And for both of those components, we look at a county's total as a percentage of our 8 county total. So we look at Bannock County and what percent of population Bannock County has, what percent of assessed market value Bannock County has. So we'll start in the 3 columns on the left in the green, which are our population numbers. So Bannock County does have the largest population in our 8-county area by quite a bit. Our census data that we got at the end of March says Bannock County's current population is 90,400 people. That comprises 48.5% of our total 8-county population. So the dollar amount requested based on population is $805,313. Moving to columns 4, 5, and 6 in the purple, where we look at property market valuation for taxes. Again, Bannock County has the largest percentage in column 5 at 43.9% of our overall market value percentage. So the dollar amount based on that component would be $311,962. For a total county aid request of $1,117,275, which is 47.1% of what we're requesting from our counties. Even though we're asking for level funding, fluctuations in market value and population can result in swings to different counties. This year for Bannock County, it results in a 0.7% decrease. So we can look at that, what drove that in the table below.
Can I ask you a question here real quick?
Yes, sir.
Where does the census, the population number come from?
From the Census Bureau. We get that every March.
Every March?
They release new data. And when I was in Power County on Monday, they asked about their number because they've been pretty stagnant for quite a while. And the number was higher than they thought it was going to be. So Cherie Sprague, the clerk over there, checked it online while we were sitting there. And in fact, that's what the Census Bureau says Power County has. So
I just checked and you're right with our number, so.
okay, cool. I'm happy to hear that. Okay, so in column 1, your current year contribution is $1,125,438. In column 2, you have a decrease based on the population factor of $1,811. In column 3, you have a decrease based on the assessed market value component of $6,352. We're requesting 0% or level funding from the counties overall. So when you net columns 2, 3, and 4, that's a decrease of $8,163 for a total request of $1,117,275. And again, that's both the original county aid and the additional county aid that's the result of House Bill 316. And we can dive, on the next page, we can dive into those numbers that we're basing this on. So in the top table, the left hand in the blue is the population, the right hand in the green is the market value. So we showed that Bannock County's population increased by 1% or 883 people. That was not the biggest percentage growth, although it was the biggest number growth. Oneida County actually had population growth of 5.1%. They're a smaller county, so that's not a huge number. And then our lowest population growth was in Caribou County at 0.4% or 29 people, for an overall growth rate in population of 1.2%. And that's nice to see because there have been many years where we've been in the negative for population or at 0. So it is good to see some growth. On assessed market value, Caribou County had by far the biggest jump in that at 22.6%. And my understanding is they're just sort of catching up the way that, other counties have been going through this. And we've seen pretty big jumps in all of our counties over the years. But this year it appears it's Caribou County's turn. Butte County and Oneida County had the smallest percentage growth at 4.6%. So our overall increase in market valuation was 9.9%. And then the table below is just sort of for your reference and information. These are the 7 public health districts with their primary office listed next to their district number. The Caldwell area, District 3, had both the biggest number growth and percentage growth in population at just over 8,000. That was 2.5% for them. District 2 had the smallest population growth, both number and percentage-wise, at 0.7%. So overall, the state grew in population by 1.3%. When we look at assessed market value, we're seeing something that we have not seen in my memory, and that was District 4, which is Ada County, Elmore County, Boise County, and Valley County, saw a decrease in assessed market value of 6.1%. So yeah, we just have not seen that at all. And then our neighbors to the north, based out of Idaho Falls, saw the largest overall increase in assessed market valuation at 20%. So the state as a whole saw an increase of 3.7%. Okay, so then we'll turn to page 7, which is our budget request. I'll explain the columns and then work our way down the rows from top to bottom. So column 1 is our current year adjusted budget that we're currently operating under. Column 2 is our original budget that was approved at our budget hearing last May. So occasionally we will have changes in our funding that we don't anticipate. We'll have maybe a subgrant that comes in higher than we thought it might or lower than we thought it might. And if it is a significant enough impact, then we will go to our board and present those proposed changes, and then they vote on whether or not to accept those. So column 1 is again what we're operating under right now. Column 3 in the yellow is what we're proposing for fiscal year 25 to begin July 1 and run through June 30 of 2025. Column 4 is the number change, and column 5 is the percentage change. So I'll start at the top and work our way down. Our first row is our FTEs, or full-time equivalent employees. We are projecting a decrease of 3.25 FTEs. That's a 3.7% decrease. Our expenditures are also projected to go down by 1.1%, a total of $101,830. So we have 3 expenditure categories. Personnel is our largest expenditure category. We are projecting a decrease of 1.8%, or $127,359. That does include a 3% merit pool change in employee compensation that was approved by our board at their April 11th meeting. Our operating expenses are projected to go up 5.8%, or $135,573. That is primarily driven by what we have experienced over the last year, a pretty dramatic increase in private pay immunizations, which is something that we didn't anticipate, but they have just kind of gone through the roof. A lot of travel vaccinations is really driving it. So that's something that we bill insurance for, and so the expenditure is pretty much offset by fees. We are not anticipating any capital outlay costs this year, and so that's a decrease of $110,044. So any questions on those expenditures?
Typically on your capital outlay, what are you spending that on?
Currently, it's mostly building kinds of facility maintenance projects, like redoing our parking lot, or the stairs on the west side of our building were kind of falling apart, so we had to have those replaced. We had the roof replaced a couple of years ago, so it's usually things like that. We moved to leasing our district vehicles a couple of years ago on the recommendation of Bingham County, and so we're no longer purchasing vehicles. That used to be a capital outlay expense, so that has shifted to operating because we're paying those leases as an operating cost.
Okay.
And how many buildings do we have in the 7 counties?
We own currently 3 buildings. So we own this building, our building in Malad, and our building in Bingham County. Bear Lake County is a little bit unique. The county did not have a building that we could utilize. So a private landowner remodeled a piece of property that he had to our specifications at his cost if we would be willing to sign a long-term lease, so we did that. All of our counties and then the remainder we rent from the county, and we pay a consistent lease fee to all of those counties, and that private landowner, it's about $10 a square foot. Any other questions on expenditures? Okay. So for revenue, we're projecting an increase of $55,040. That's a 0.6% increase. Again, we're asking for level funding from our counties. So for Bannock County, that's a reduction of $8,163. There are also small reductions for Bear Lake County, Bingham County, and Power County. Caribou County, because of that pretty big swing, excuse me, in their market valuation, has a 5.1% increase. Franklin County, a 1.5% increase. Oneida County, a 1.5% increase. And then Butte has, because of a rounding issue, a $1 increase. Our subgrants are going down $339,833, or 6.8%. That is largely because we are winding or ending COVID funding and subgrants that had been in place during the pandemic. We're projecting a pretty significant bump in our fees, and again, that's to reflect that increased volume in private pay vaccinations. We're projecting to use less funds in our opioid drawdown at this point in time. The first year, we did have some startup costs like training and that sort of thing that were a little bit more than we anticipate that we'll need in this next year, and we are not proposing to use any of our district reserve funds to balance our budget this year. So any questions?
Questions?
Nope.
Nope.
Okay. So then the next page just has a brief synopsis of some of the our major programs. Page 9 is additional language from House Bill 316 because they did also change the requirements for our budget hearing. The chairman of each board of county commissioners is expected to attend based on this statute, or they may designate a proxy. Ernie is your chairman and is also the board member, so that should be relatively straightforward. You won't need the proxy unless for some reason, Ernie, you're not able to be there this year.
So you got help with you. We're going to put them on the spot a little bit too.
Okay.
So Bannock County pays the majority because we have the majority of people.
Of the county contribution, yeah.
So what about services? How are the services divided? I mean, like our septic systems and all the services that you go out and do. Is Bannock County 48% of it? Are they more? Are they less? Or
Do you want to talk about environment, Ken, and then I can talk about?
Yes, I would say for septic systems, Bingham County is probably it is our busiest county for septic systems. There's probably several factors that cause that. With Pocatello being the main city, I think most of the construction, they would be connecting to city sewer services. Whereas Bingham County, we see a lot outside the county, like outside the county of Shelley and outside Blackfoot. So I would say we do see a large number. Bannock County would be right behind them, but Bingham County is our busiest county for septic systems.
I talked to an individual last night and he looked at where the employees of the site were going. And most of them are going to Bingham County right now.
But then for programs like food and childcare, the vast majority of those services are done in Bannock County. And you may have gotten a handout on the food program. We've been emailing out information about once a month on different programs, and that showed the the number of food establishments in Bannock County and the remainder of the counties, and Bannock County definitely has the biggest chunk of those.
Yeah, I'm trying to remember the percentage, but it was around 50%.
Yeah, and childcare's same thing. The bulk of the work that we do in childcare health and safety inspections is in Bannock County. Swimming pools,
Those stay pretty consistent.
Yeah.
I think the most pools are in Bannock County with Ross Park, Lava, and Delmetta. There's not a lot of revenue generated from those because the fee is so small. Land development, it's back and forth between Bannock and Bingham County on that one as well. Really, that's where we mostly see Franklin County a little bit, but mostly Bingham and Bannock on land development.
And then for other services, things like communicable disease and epidemiology, the bulk, I would say over 50% of our services are provided to Bannock County residents. Immunizations, same thing. Reproductive health care and STDs, same thing. Parents as teachers, same thing. Oral health, we do quite a bit in the rural counties, but still the bulk of the services that we provide happen in Bannock County, and certainly our biggest event type thing, which is Give Kids a Smile Day, which I spoke about last time I was here. Pretty much all of those kiddos reside in Bannock County. When we talk about health promotion or community health stuff, a lot of that is centered in Bannock County. Public health preparedness is district-wide, but we do quite a bit here in Bannock County also. But when I come in June, I can bring the actual numbers to share with you so that you can see exactly what that looks like, what the numbers are.
And it just brings it up. I mean, if you
Yeah.
look at the money that Bannock County pays. And
No,
and
absolutely.
the services,
Yeah,
I just,
yeah,
you want to match.
yeah.
There's
And-
got to be,
and-
there's
and
got to
it
be a
does.
reason for that equation.
Yes.
To match
Yeah.
the services that come in.
Yeah.
Sure.
It's good.
Other
Anything else?
questions?
Thank you.
You're welcome.
Appreciate this.
Okay. Well, have a great day, and Ernie, we'll see you before too long.
Yes.
Okay, thanks again for coming to the Family Fun Day.
Oh, it was a good deal.
Yeah.
It was a good deal. Thank you. Good seeing y'all.
Okay, you too.